Hello and welcome, everyone. It's LaShawn Benedict here with my buddy, Gordon Thane. Today, we're going to be talking a bit about gaining experience in the public health field, some career strategies, and broader insights of the industry, particularly taking the perspective from undergraduate students.
Ooh. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
All right. So in this episode, we're kind of going to try rapid firing again, even though that never works out for us because Gordon loves talking. And just joking. But we're just going to start off. Let's get into it. So, Gordon, how important are internships, networking, and extracurricular activities for public health students at the undergraduate level?
For a variety of reasons, of course. So when you're looking at, there's three elements there, and there's some overlapping in the approach, and then there's some uniqueness depending on which one we're talking about. So I'll attack the networking one first. Networking is important for a variety of reasons. I would say the number one benefit of networking is to gather information. And a lot of times you go into a meeting with someone or interaction with someone with a particular agenda or motive to learn about something specific, and you end up learning about that and like many other things that shape your worldview or give you a different perspective to look at your situation. So I find that when I look back at my undergrad experience, that's something that I was very weak in because I was very singular-minded in terms of medicine, kind of life sciences, that type of thing. I didn't really understand a world existed outside of that. So had I gone to more like workshops and seminars, which are happening all the time on a university campus, I would have been exposed to more things, been able to meet more people, and pointed in different directions. And then it would have been then up to me with all the information I had to make the best decision. But without networking, you kind of just go through the motions, and you're only able to pull from information and knowledge from people in your immediate surroundings, which can be good if you have very resourceful and driven friends. But if you're all in the same boat with like that singular focus, you miss out on other things that you could be learning. So that's why networking in particular is important and something I reflect on, and I should have done a better job while in undergrad.
Yeah. And the internships and extracurricular activities part is also important. Just reflecting back when I was in my undergraduate program, a lot of my focus was on doing well in courses and having a high GPA, which honestly is important, but what I think is more valuable in the long run are what are your experiences? Your experience is not getting a good GPA or a good grade in your course. Your practical experiences come from things like pursuing internships, doing extracurricular activities, meeting different people, potentially working together on different projects outside of your formal educational curriculum. Those are things that can be transferred into different job settings when you are employed in the public health field, for example.
And that ties in like very well to the next two questions. And by the way, we source this off a very popular, thriving Reddit community. And these are all great questions that we felt resonated based on conversations we had previously, as well as a lot of unanswered questions and a lot of gray area type questions where there's sort of not a yes or no answer. It's sort of it depends. That answer that a lot of people are not fond of. They want you to kind of tell them the right answer. But the other one is around how to best leverage an undergrad experience to prepare for public health, or what types of internship or practical experiences are most valuable for people who want to go for either a Bachelor of Public Health degree or a Bachelor's of Science or a Bachelor's of something, to take that into an aspiring public health professional after graduating, whether it's immediately after or after pursuing a master's. So how do people set themselves up for success after graduating an undergrad degree, you leveraging what exists in that environment?
Yeah, and specifically, what does that look like? Well, if you're able to find different internships, volunteer opportunities at reputable organizations in your country or your province or your city. For us, for example, many students think about the Public Health Agency of Canada, Ontario Health, Public Health Ontario, Toronto Public Health, or any of the health units within Ontario. Those are places that students always look to find their public health experience. And at the undergraduate level, if you're able to find volunteer opportunities or internship opportunities or ways to get involved with those organizations, you're able to better make connections and understand the skills and what it takes to be a professional in those settings. And specifically, it goes back to Gordon's point about networking. If you're able to find someone within one of these organizations that you're working at or interning at, and you do a good job, they're more than happy to write you a reference letter or support you in your application and through your job seeking journey. I guarantee you that you will find someone if you put in effort to find that person. So don't forget that when you're applying to any job, of course you need your resume, you need your cover letter, but who are you going to ask when the employer asks you to provide reference letters? You can't ask your parents, you can't ask your sister, your brother, or your dog. You got to find professional or academic references that can vouch for you and know how you perform in different settings, right? So having those connections set out as early as possible increases your chances for success in public health when you're looking for jobs.
The other thing I would throw in there is, you know how we had that community engaged learning course?
Okay.
Where in the program itself, there's a course that pairs you up with a local organization that does public health work or social services work or something related
books.
something related to health or public health education, for example. And that was a very valuable experience. Even though I'm talking about my master's experience, that also exists at undergrad level, whether it's through a course or a lot of times a school, LaShawn, will have like just general bucket of placements that they work with community organizations with, that you could go there, check out the project to see if it resonates with skill sets you currently have or skill sets that you're trying to learn, and engage in that way. And the reason I think that was a valuable experience is because I did it. It was like a 3-month course, I think, LaShawn. 3-month course. It was involving developing a health evaluation, economic evaluations, some measurement tools in terms of how effective their program was. And that's something that you could look at as a course and like, oh my gosh, I'm done the assignment, I'm done with it. Instead of having that approach, what I did was I maintained very great relationships with the staff that I was working with there. And eventually, an opportunity came up where there was a vacancy under board of directors. And because I had that relationship with them, I was familiar to them. I applied. I was the youngest they've ever considered at the time. But because it's like, why is this guy still here? You did like a little homework assignment, bro. Like, chill. I'm like, no, I'm around. I believe in the mission values. I have a lot to offer. And next thing you know, I'm there. And then now I'm the vice chair of the board. And, that experience, yes, it's volunteer. But on a CV or in a resume, as far as a leadership perspective,
Yeah.
it goes a very long way. So
Yeah.
if you're
Yeah.
talking about leveraging something that's free, that's as free as it gets, and it's paid me back tenfold at this point.
Gordon, this actually reminds me of a story that I also want to tell, and maybe you don't really even know it, but it's related exactly to what we're talking about. How you're in the undergraduate level and you're trying to think about different experiences. This particular story, I wasn't even aware of what it would yield. So in my undergraduate degree, I did a degree in biochemistry. One day I went to it was like an event where they were talking about different organizations, and I wasn't really down for it, to be honest, but I pushed myself to go anyways just to see what it was about because there was a lot of chatter about it. I decided to just kind of walk by different posters and to see what was going on. One person kind of looked at me and smiled, and I decided to say, "Hey, how's it going? What's up?" And then they were telling me about how they knew this organization and how it could be a very interesting thing for you to look at. And it was a role as a homework helper for one of the local organizations in Scarborough. And this was back in, I want to say, 2014. So, over a decade ago now. And again, I wasn't
sound so old.
Yeah. I mean, I wasn't even thinking about public health then, right? But it was actually for a community health, public health organization. But I was working as a homework helper, helping people with their homework, math, science, and English, right? And I didn't think too much of it at the time. I volunteered there for a year or two, and things happened, and I had to move away out of the city, pursue a master's degree, another master's degree, and then I'm finally in the workforce. And then, Gordon, similar to you, an opportunity arose where there was a board of director opportunity for that same organization. And you better believe that in my statement of interest, I included that, hey, I was a part of this organization as a volunteer, and that holds a lot of weight to show your commitment and you know about the organization and you volunteer there. So even though something may not seem to be relevant, you could always look back and make connections and think about how you could utilize those as you go forward a decade later, for example, right? So it's really up to you to see how you can make connections to the field that you want to pursue. Was that a good story, Gordon?
That's
Did
a
you
great
like it?
story. And you foreshadowed the next question, which is, how can students identify public health roles that align with their interests and goals?
Yeah.
And it's part of it is doing exactly that. How do you know what you want to do unless you do it?
Yeah.
Right? So I would say you need some kind of exposure to what a job might look like to know if that's something that's for you or not. That's one way to do it. The other way to do it is to talk to people. So if you feel like, hey, I'm going to make this commitment and do this 3-month or 6-month internship, it's important for your well-being that you kind of do something that you like. So you want to make an informed decision to do that. So you want to talk to people who have done it, who have opinions, who have experiences that they can share with you, for you to then make up your own mind if something is for you. So you can learn by doing and learn by talking to people who have done. So that's what I would say in terms of identifying roles, because otherwise you have no idea. There's thousands, hundreds of different public health roles. And there are some that are related that you can make inferences from. And then sometimes you might work with colleagues who are in those roles and you're like, oh, I hate LaShawn's work because all he does is do presentations and crunches numbers. I would never want to do that. And then you can learn that way.
Yeah. And then another sneaky tip too is you're already in school. You can utilize professors or your teachers or instructors as your resources.
Right.
And what better situation can you be in if you get a really good grade in their course and you just start probing and asking some questions about, hey, what you can do in the future in the field. And then they might hit you up with well, I actually have a research assistant position, or I have a collaborator that is actually looking for someone with your skill set and knowledge. Boom, right there. You got to avail yourself to your opportunities. It's not just going to come to you.
Preach.
All right.
The skills one. That's a fun one. So what complementary skills are most valuable in public health?
Right.
Things that you would tell yourself now if you could speak to your undergrad self based on this question, I would have done things a lot different, right?
Oh, completely different. Of course, in any field, you're going to have your standard writing skills, presentation skills, oral communication skills, working with a diverse team. Like, those are obvious. But what are some of those technical skills you could learn that will help you get into your field of interest, in our case, public health? Well, the most important thing I would say to undergrad students and master level students and doctoral level students, and even if you're not a student and you're interested in public health, project management.
Oh, I didn't know you were gonna go there with it. Just kidding. Who am I kidding?
Who are you kidding?
Who are you kidding?
Every single thing that you're gonna do in the job force can be tied back to a specific project. If you're able to understand the nuances of how to manage a project, you're already 10 steps ahead. Okay? So you will see I guarantee you, on any job posting, whether it's entry level, mid-career, late career, they will always ask you about your organizational skills, your ability to manage projects or do specific projects or work together on a project. If you already know that's coming at the undergraduate level, what are you waiting for? This is an important skill. And you might be wondering, why? What does project management have to do with organization? It provides you with the proper framework of how to approach any given situation that you will face. You're talking about things that are essential in any work setting, like your costs. So believe it or not, if you're working on a public health project, there are going to be costs and resources that are put into complete a project. There's going to be people you're working with. How do you engage and communicate with the people? How do you make sure the timelines for a given project are on track? You can't just start a project and finish willy-nilly 4 years later. You have funders to think about. You have so many different stakeholders. You have the actual scope of the project. Maybe you're starting off tackling cardiovascular disease, and you can't halfway through switch into mental health just because you feel like it. No, there's specific requirements that are needed in the job. Project management gives you a lot of the framework you need to conceptualize these things and actually carry the work out.
That's a good answer. I would even ask a question. As you were talking, I was thinking about it. Does a BPH or MPH help you do project management? Or does project management help you do public health?
I think both of them actually contribute to your
think about the relation. Because my in the headspace I'm at right now, I think an MPH allows me to be a better project manager because across all disciplines, project management is probably the most ubiquitous skill.
Ubiquitous.
And communication, obviously.
There we go.
But you know what I mean? So public health at MPH or BPH gives you the subject matter expertise to enter the project management world in public health. But after that, it's all project management.
Yep.
It's all so that ties nicely into I can't outdo you for how you frame that as a core skill, but tying that to the question, LaShawn, about the long-term prospects or long-term career paths for public health professionals starting with a bachelor's degree or a bachelor's in public health. If you want to maximize a BPH, that's the type of stuff you have to be doing. So there are competencies that are tied to a public health practitioner, right? You can Google public health professional competencies. You'll see them. Advocacy, leadership,
basic
program
public
planning,
health sciences,
evaluation, understanding public health sciences, data, blah, 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 blah. And you'll get that from any public health training, more or less. But what is not there? What's missing? How can you fill those gaps in? Right? Project management is one. There's other areas like quality improvement out there as well. And those credentials are accessible to people who don't yet have a master's degree or who plan never to get one.
That's right.
So if you're in a position where you want to try maximizing a bachelor's degree, or you don't have any choice right now to do a graduate level training, these are some of the types of things you can do to maximize your value in a competitive job market.
Yeah.
To get seen from a different perspective.
Yeah.
So you could say, maybe I don't have the formal level of public health training as LaShawn, but LaShawn ain't got this.
Yep.
You know? And what you're asking to do in a job posting is a lot of what an MPH or bachelor's or public health person does, but half of it is this other skill set, which I clearly have with this credential. So that's another way to maximize and get every last drop out of your bachelor's degree, much like an MPH, right? You can have a similar conversation about should you go and get a doctoral degree having an MPH degree already. And we would be saying the same thing. How can you maximize what you currently have before considering other options? And it's the same if you're in a bachelor's program too.
Yeah. So the last couple of questions that we wanted to tackle are more focused around some industry insights, if you will. So, Gordon, I love asking you this question because you have some really good experience thinking about the relationship between these two things. How do location and willingness to relocate impact job prospects in public health?
It's everything.
Why is that?
It's everything. Because if you just kind of have a holistic view of how things work, it's very helpful. So if you think of big urban centers, so it's going to be a huge hub for immigration. It's going to be a huge hub for a lot of academic institutions. It's going to be a huge hub for a lot of companies, right? So you have it here in an urban center like Toronto, for example. It's saturated in terms of population density. It's saturated in terms of the skill set and level of education that exists. And you have a larger number of people competing for a fixed or slowly growing number of jobs. So it puts you in a position where there are very qualified people that aren't able to get a position that matches their skill set. And then they have to take the next thing down. And then as you go bump down the list, you have bachelor's folks or master's folks who are very, very, very qualified for the things that they're applying for and yet are not able to close the deal. Okay. So that's the reality of the situation looking at a densely populated urban center, for example. Right. A very attractive place to live, a lot of immigration, lots of schools where people can get the training and get qualified for the positions that are in that community. Now, look at another community now. A community, for example, that does not have a Master of Public Health program, right? A community that's not as densely populated. Sure, there might be less employers there, right? As you add one thing, you take another thing away. But think this out for a second. In this community, if they have requirements for an MPH or requirements that you have at least a bachelor's with 3 years of experience, and they don't have the program in that community at a school, everybody who's working in those jobs would have are people that have lived there and then went to study somewhere else and came back, or people who studied somewhere else and then moved there. How many people want to actually do that?
Yeah.
You have a family, your friends. How many people want to relocate? So relocating in of itself becomes an advantage because it takes a very specific mindset and willingness to do that.
Yep.
That other people don't have. And that narrows and screens out people for you in of itself.
Yeah.
So that's what I did. So I live in London, Ontario. Very persistent, not for lack of trying. Was committed to getting a job after my Master's of Public Health degree, or before I even graduated. Going, nothing. And then 2 hours west of me, where I live, and keep in mind, I'm married, live with my wife, my dog. So
Dogs.
at the time, one dog.
Oh, okay, true. Gotcha.
And my wife is working for very good company and not in a position to relocate. So, hey, if we do this, I'm working in a different city, commuting, living during the week in a different city, coming back on weekends. It's very difficult. But sometimes those are just sacrifices you have to make to accelerate your experience. So I could have probably taken something I was overqualified for and worked my way up in 2 and 3, 4 years. But that 1 year of going away to a different city set me up to come back, right? Now I'm competitive in those big urban centers. Now I'm competitive in the city that I live in. And now I'm able to get more. I can meet my preferences. I can be picky and I can be the picky and choosy one now. After having that experience. So short-term pain, long-term gain.
All right.
Speechless.
That was a good one. Should we end it there?
Let's end it there, Skip.
All right. Well, thanks, Gordon, for your amazing insight. This has been LaShawn and your buddy Gordon on the Public Health Insight Podcast. Again, there's a feature that you could check out in our description that allows you to communicate with us via text, and we'll get whatever question you ask us. And if you send in a question, we'll highlight some of those questions in one of the future episodes that we put out. So with that, peace.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.